Go.
Hello, my name is Trishna Danawala, and this is my persuasive speech. This is my audience. And these are my note cards, front and back, front and back. Okay. Each year, more than 480,000 deaths are caused by cigarette smokers in the United States, according to CDC.gov in 2021. Even if you do not smoke, smoking affects everyone, either through increased healthcare costs, environmental damage, or the emotional toll of seeing your loved ones suffer from smoking-related diseases. I do not smoke, but I have, however, been affected by the consequences of smoking through secondhand exposure. So, as someone who wants to be healthy and stay healthy, I have done extensive research on the impact of smoking. So today, I will be sharing you with the health risks of smoking, the factors that contribute to smoking, and the strategies to help alleviate this problem. Let's first talk about the problem, the health concerns. In a TED Talk in 2018, Krishna Suhir said that each inhalation brings more than 5,000 chemicals into contact with your body's tissues, meaning that smoking does not only affect your lungs, but it also affects your body's immune system and weakens it so it can't fight off damage or diseases done to your tissues. So we don't smoke, but how does it still affect us? Well, cigarette smokers affect themselves and those around them, especially pregnant women and children. According to the American Cancer Society in 2023, they reported that pregnant women who are exposed to these smoke-related chemicals, their babies are at risk of developing childhood cancers such as lymphoma, leukemia, and brain tumors. Smoking is dangerous, but what makes it so addictive? Well, in these tobacco products, there's a chemical called nicotine in there, and its pharmacokinetic properties and the way that it processes in our bodies contributes to its addictiveness. To illustrate, a study done by Osman and O'Halloran in 2010, the 68.8% of those interested in quitting smoking, only 6% of them were successful. This illustrates how addictive these tobacco products can be. I am sure you are all thinking that we can just change to vaping because it's safer. Well, you are right, it is safer because it has less chemicals in it, but it doesn't mean that it's consequence-free. Ravi Johar in 2016 said vaping affects 148 genes in the brain, leading to permanent significant behavioral changes. I conducted a class survey. I first asked my class if they have ever smoked a cigarette. 88.9% of them had said that they have not, and this statistic is important because it shows that the majority would rather continue with a positive smoke-free lifestyle. It also reestablishes the message of avoiding smoking altogether. I also asked my class if they believe that smoking causes lung cancer. The majority of the class has voted yes, and this illustrates that they are aware of the dangers of smoking. So we know that smoking can be dangerous, but what contributes to people to start smoking? Well, the first contributor is how accessible these products can be. The low prices and easy access to tobacco products contributes to the high smoking rates, especially in low-income households. The next contributor is the lack of awareness. In a study done by Jay Lee in 2023, out of the 459 patients in the study, only 193 of them were aware of the free telephone smoking counseling service available. Despite the well-known concerns of smoking, there are still some people unaware of the consequences or the resources there to help them out. I also asked the class in our class survey what their main reasons for not smoking were. Everybody had said that their main reasons were their health concerns. This shows that their health is a motivator to help them to not smoke or to quit smoking. So what can we do to help this, and what are some strategies we can do to prevent smoking? Well, the first is support. By providing multiple support systems, it can essentially reduce the smoking rates. Each state in America has cessation quit lines that offer free counseling through a toll-free number. The second strategy is restrictions and regulations. By implementing more regulation on tobacco products, we can significantly reduce the hospital admissions of heart attacks. For example, in a 2011 study in Arizona, they implemented a state law that prohibited smoking in public places, such as workplaces, restaurants, or bars, and that's led to a reduction of 21% of hospital admissions for heart attacks. Talking about the class survey again, I also asked the class how, on a scale of 1 to 5, how dangerous they believe smoking is. 77.8% voted a 5 out of 5. I also asked the class if they agreed on having regulations or restrictions in public places for smoking. The whole class agreed, and this shows that they are on board of making sure that smokers are preventing this habit. To come into conclusion, the health impacts, underlying factors, and available solutions make it clear that we must take action to prevent this problem. Smoking endangers our health. It is influenced by economic factors and insufficient knowledge, which can be resolved through support systems or restrictions. I hope you now understand the depth of this problem and are encouraged to spread more awareness about smoking. Thank you for listening. This is my audience.